Well, Lois, there was a time when real men didn't eat quiche, and there was a time when real men didn't have a facelift, but times they are a-changin'. Not only are men eating quiche, they are getting their faces lifted and talking about it as well. Other than hair replacement, nose, eyelid, fat reduction, and a facelift are said to be the most popular aesthetic surgery procedures for men. Dr. Sherrell Aston is one of the most famous plastic surgeons in the New York area and is an associate professor of surgery at New York University. Thanks for joining us on America's Vital Signs tonight.
Thank you, Dave.
Has this become the biggest change you've seen over the last few years, more men getting plastic surgery?
Well, that is one of the major changes, Dave. More men are having aesthetic surgery procedures. There are probably two main reasons. One is professional and the other is social. And certainly the youth-oriented society that we live in today has prompted men to want to look better. And certainly the corporate boardrooms have been invaded by the concept of power coming from a youthful source, and people who feel better about themselves and look better tend to have that image. So certainly aesthetic surgery plays a real role in the professional world.
But you probably heard it in the past, Doctor, that some guys are kind of reluctant to have plastic surgery, much more so than women. What's working here? Why were men the last to be dragged into the operating room?
Well, Dave, I think it's just a matter of the concepts changing within our society. First, the ladies were having aesthetic surgery and didn't talk about it. Then the magazines started to popularize the procedures, and the television shows talked about aesthetic surgery, and the ladies started talking about it.
Is it because, I mean, really, in our society, most Western cultures, I mean, there's a lot more emphasis on the woman being beautiful than for the man to be necessarily handsome.
Well, that's very true.
That's changing,
That's
right?
very true, and that is changing, because men also want to look as good as they feel. Often a man who's in his mid-50s will feel very vigorous, but yet the bags around his eyes or the sagging along his jawline may make him look somewhat older, or as if he's not in such good health.
Yeah, I wanted to ask you about that. You know, when you talk to a psychiatrist, sometimes you think they're looking through you, wondering.
Yeah.
And as I talk to you, I get that sort of distinct feeling at times, this guy could use a little of this and that. What do you think?
Well, Dave, as we talk to people, we can't help but analyze their faces a little bit, because that's the kind of thing that plastic surgeons do every day.
Right. And your conclusion?
Well, when the time comes, you will let your plastic surgeon know. You'll be the one to make the decision.
Didn't he get out of that gracefully? I love it. All right, and a lot of people, you're a very nice-looking guy yourself. I don't know how old you are. A lot of people said around here this evening, gee whiz, I wonder if he had some plastic surgery.
Dave, I haven't. I'm 47. I will have plastic surgery when I think the time is right for me.
Okay. Now, for a guy who may be sitting out there tonight thinking about plastic surgery, first of all, the most popular one is getting rid of the bags or the nose job?
Well, it depends. In the older age group, it's the eyelid surgery. The largest number of aesthetic surgery procedures performed for men are rhinoplasties, nasal surgery, blepharoplasty, the eyelid surgery, then liposuction, removal of fat deposits. But the rhinoplasties are mainly in the teenage boys in the early 20s. Fewer older men have their nose operated on.
All right. Now, how long does it take to recover, and how painful are these procedures?
Well, eyelid surgery is not very painful at all. There's usually some swelling and bruising that lasts.
But you aren't talking about outpatient therapy, surgery here, though.
Well, the discomfort following surgery would be the same whether one were in the hospital or if one went home. There's not much discomfort. Mild analgesics usually take care of the discomfort with eyelid surgery. But there is some bruising and some swelling that will persist, and it varies from individual to individual, from 5 days to 10 or 12 days.
Okay, and what's it going to cost me?
Well, the eyelid surgery in the United States probably ranges from $2,000 to $6,000, depending on the locality and depending on the surgeon.
And depending on the surgeon is a good point to raise, because with plastic surgery becoming more popular these days, you're also running into people who are not qualified to do the procedure, aren't you?
Very true, Dave. And that's one of the main concerns for the public and for the individual thinking about aesthetic surgery.
How do you weed out the bad guys? What do you do? How do you ask them?
The simplest way for an individual to find a qualified surgeon is to call the plastic surgery referral number that is provided by the American Board of Plastic and Reconstructive Surgeons.
And for our viewers at home, we'll post that on the screen for you. There you have it.
And this organization represents plastic surgeons who are certified by the American Board of Plastic Surgery, which is the only organization that certifies that an individual has met a certain level of training and a peer review examination.
All right. Dr. Aston, thanks for being with us tonight.
Thank you, Dave.
All righty.